really close.
Okay, so the ureters lead from the kidneys to the bladder. So here's the bladder from the side. Here is a ureter right there. So this is kind of the best view of the ureter right here. When we get to the bladder, that's this in the male. On the female, it's this right here. Either one, they're the same. Bladders are the same, male or female. So we'll just use this one. The top part of the bladder is called the fundus. Then see this sort of triangular area? That's the trigone right here. It's like 14 and 15, kind of like this triangle. And then as it narrows down here, this would be the neck of the bladder. And that leads to this tube, which is the urethra right here. On the female, again, fundus, trigone, the neck, and then the urethra right there. What am I missing? The urogenital diaphragm. Let's do that first so that you can understand the other things. The urogenital diaphragm is just the muscular floor of the body. See this piece of muscle right here, this red tissue? That's the urogenital diaphragm. Okay. Now there are two sphincters that control the urine coming out of the bladder, so to basically keep urine from just coming out of the bladder whenever it wants to. You have an internal sphincter, which is just this muscle right around the neck of the bladder, like right at the top of the urethra. And then you have an internal sphincter that is just a circular muscle right around the urethra, and it's in the urogenital diaphragm. So if I'm pointing at the urogenital diaphragm, I'm pointing at the whole thing. If I'm pointing at the external sphincter, I'm just pointing right there. So just right there. And then the external urethral orifice would just be the hole that leads outside.